Welcome to my podcast, Why Didn't Anyone Tell Me This? With my guests, we are discussing reproductive health issues, questions you may have about your health, and debunking some of the many myths around our health. And in this series, Beyond the Bleed, periods, endometriosis, PCOS, and more, it's a pleasure to talk to Dr. Jackie Maybin about her work on the menstrual cycle and periods. Jackie is a reader and consultant gynaecologist at the Centre for Reproductive Health at the University of Edinburgh and at NHS Lothian. She runs a specialist menstrual disorders service offering medical and surgical treatments. Her research team aims to develop better preventative and therapeutic strategies for problematic menstrual bleeding, a common and debilitating symptom. She holds a Wellcome Clinical Career Development Fellowship to investigate the role of hypoxia in menstrual physiology and pathology. She's also examining the potential link between COVID and menstrual disturbance. Jackie is also president of the RCOG Blair Bell Society, a member of the Royal Society of Edinburgh's Young Academy of Scotland, and chair the National Menstrual Clinical Network for the Scottish Government. Welcome, Jackie.
Hi, Joyce. Lovely to be here.
So, Jackie, I start by asking my guests what led them to the career they're doing now. So, can you tell me more why you wanted to be a doctor and what sparked your interest in menstrual disorders?
Sure. I think I was probably one of those very annoying children who constantly asked why. And I think that's probably the reason why I've built an entire career around the question of why does this happen. But at school, I was probably torturing my teachers by asking them why. I think I drove my parents around the bend. So that led me to apply to medical school because most of the questions I had were about human biology. And I think when I got to medical school, although those questions were all answered, I felt that with every answer came 10 more questions. So I decided to go down a clinical academic pathway. And I think I had probably a little bit of a light bulb moment when I realized that if all these questions were going around in my head, then probably no one knew the answers. And it was up to me to try and find out the answers for myself. So I went into obstetrics and gynecology and couldn't answer the questions that a lot of my patients had about menstrual disorders. So set up a research lab to try and find those answers so that I could perhaps come up with some decent answers for the people sitting in front of me in clinic.
Fantastic. And we're going to delve deep into some of those questions and answers, hopefully, today. And I've been doing a lot of work with women from all ages, and you've helped with some of this around asking them about their periods. And it seems at schools, we nowadays don't like to talk about what's normal and abnormal. So that's something I really want to delve into today with you. So can you start by explaining what's a normal menstrual cycle and a normal period, or the proper term, menstruation?
Sure. I think the first thing to say is that what's typical for one person may not be typical for another. So there's a lot of natural variation, which can make it quite difficult to pinpoint what's normal. But we've been helped out in more recent years. Probably 2011 was the first consensus of all global experts looking at all of the data from around the world and trying to figure out what those averages might be. So the FIGO committee sat down and standardised that, looking at how long a period should last, which is normal, is less than 8 days. Sort of how much bleeding there should be, and they've defined that as something that is manageable for the person experiencing it. And then looking at how big a gap there is between periods or how regular they are. And normal is sort of anything between 24 and 36 days. So one period every 24 to 36 days, with a bit of variation between women and also a bit of variation in individual women. So 1 month it may be 28 days from first day of one period to first day of the next. And the next month it may be 32 days. And that's still within those kind of normal parameters. So there's a wee bit of variation, but I think those definitions and looking at all that epidemiological data has been very useful for standardizing what we think of as typical.
Yeah, so at school, we're normally taught that we have a 28-day cycle and we have ovulation on day 14. So do you know how common is it to have a 28-day cycle?
It's probably not very common actually. It's it may be sort of right in the middle of those figures, so that's what we describe. But I think someone who has a period every 28 days bang on is actually very unusual, particularly if they're not using hormones and things to regulate their cycle. And that's okay. I think it's perfectly normal for there to be that wee bit of variation between people. It's really hard to grasp all these figures and sort of work with them. But what I usually say to people in clinic is if it's manageable and you're able to do your normal activities, then great. If something about your period or your menstruation is stopping you do the things that you need to do or love to do, then that's really when you should be seeking help. And that's probably a better way of defining what normal is the impact it's having on your life.
So if a woman has a cycle that's shorter than 24 days or longer than 36 days, should that be an alarm bell for her?
Well, yes and no. Sometimes it's manageable and it's 23 days and it's okay and it's not causing too many problems for her. It's not a complete red flag the way bleeding in between periods or bleeding after the menopause would be definitely something that you would need to get checked out. The other end of the spectrum, if you're not bleeding often enough and you're not using hormones to take your cycle away or prevent your bleeding, then that can be a bit more worrying because you need to have, if you're not taking hormones, about 3 periods a year at the minimum to keep the lining of the uterus healthy. It does need to shed at least 3 times a year. So if you're really not having a period and you haven't had a hysterectomy or you're not using hormones to take your periods away, then I think you probably should be seeing your doctor to make sure that everything's okay and that you're not having any sort of changes in the cells of the lining of the uterus that could cause problems in the future.
I just want to delve into that a bit more because I recorded yesterday the podcast with Ertan about endometriosis, and we discussed
Mm,
this view that another myth maybe that we have that women need to have a period all the time. I've heard some people say, but it sort of
yeah,
purges them and it renews them. But Ertan was saying that
mm,
historically women spent most of their fertile years actually pregnant, so they didn't
mm,
have periods or breastfeeding.
yeah,
So, how do you feel about that?
yeah.
Do you feel that women have to have a period? Do they have to have 12 or 14 a year?
No, no, and there's a lot of personal preference with this. The caveat being that if it's your natural cycle and you're not using hormones, then there can be a bit of a build-up inside if you're not menstruating 3 times a year. Um, if you're using hormones to treat problematic periods, that keeps the lining of the womb usually quite thin and stops that build-up inside. So there's no absolute need to bleed in that scenario. So if you're taking something to manage your periods and that's keeping the lining of the uterus healthy, that's one scenario. If it's your natural cycle and you're not bleeding 3 times a year, then I think in that case you probably need to make sure that you're shedding and things aren't building up inside. So there are two completely different scenarios. There's no need to bleed for your health if you're taking hormones that keep the lining of the womb healthy.
Great, thank you. I'm glad both of you agree about that, which is always good.
Mm.
Now, let's delve a little bit into the hormones. So, our menstrual cycle is controlled by a number of hormones that can have really profound effects on women physically and psychologically, which we'll come into in
Mm.
a moment. But first, can you just explain what's happening to the hormones through our menstrual cycle?
Sure, sure. So, like most things in the body, your hormone system and your ovaries and your reproductive system and your uterus are all controlled by a signal that starts in the brain. So the brain signals to the ovaries to produce sequential hormones, so a really sort of regulated pattern of hormones, and that affects the lining of the uterus. So in the first half of the cycle, so after your period finishes, you get this increase in estradiol or estrogen, and that causes the lining of the uterus to thicken and adapt and change, getting ready for the egg to be released from the ovary. And when ovulation occurs and that egg's released, then what's left behind is something called the corpus luteum. And that structure produces really high levels of progesterone, which is the second hormone that's produced from the ovary, the second main ovarian hormone. And that hormone really fine-tunes the lining of the uterus to really allow it to accept a fertilized egg if fertilization occurs, and to start developing into a pregnancy within and supported by that lining of the uterus. So those two hormones kind of act in concert to fine-tune the lining to get it ready for pregnancy. And if pregnancy doesn't occur, then the levels of those hormones really sharply drop at the latter stages of the menstrual cycle. And that decrease in those hormones, progesterone and estradiol, mainly that decrease in progesterone, causes a big inflammatory response within the lining of the uterus. So if we look in with a camera, as we sometimes do medically to check the lining of the uterus, if we look in at the time of menstruation, it's really raw and red and has all those sort of classic features of inflammation. So it's a bit like a wound. If you scratch your skin, you get that redness. It looks the same when we look inside the uterus, and that's the decrease in the hormones causing that inflammatory response, and that causes the shedding of the lining of the uterus. So the lining of the uterus comes away during a period, and then resets itself for the next cycle, and that high levels of estrogen go up again and everything starts to regenerate. So it's that sort of cyclical process throughout the reproductive years of a woman's life that causes menstruation to occur.
And I mentioned that they can have quite profound effects, these hormones, on us physically and psychologically. Can you delve a little bit into what can happen through the menstrual cycle? We're going to look at PMT and PMDD in a minute, but let's have a look. What do they? How do they? Can they make us feel different physically and psychologically?
Yeah, so again, the variation between people who menstruate is really quite extreme. So some people will not notice any real changes throughout the menstrual cycle. And whether that's changes in the receptor levels or just the sort of interactions, who knows? But we know that these hormones don't exist in isolation in our system. They communicate with lots of other bodily processes, and that obviously is different from person to person. So some people won't really notice any changes across their cycle. And some people are almost surprised when their period arrives because they don't get any sort of those hormonal warning symptoms. Other people are really sensitive to those changes in hormones and will describe really significant changes depending on the stage of their cycle. Things that people report in the first half of the cycle with estrogen levels when they're high, they often describe that sort of phase of the cycle as quite positive. People can feel quite good in themselves. It can change your skin to be sort of healthier looking, your hair to have a better shine, people feeling a bit more positive in themselves. It's described in quite a positive way. Whereas progesterone for some people has more negative impact. That feeling that people get pre-menstrually, so just before a period starts, where they maybe feel a little bloated, they've got breast tenderness, they can notice greasy skin and hair and just not feeling quite as good as they were previously. All of those symptoms are sort of linked to progesterone and can make people feel not quite as good in that sort of pre-menstrual feeling. Then when the period comes, then obviously that can trigger that cramping feeling as the lining and the muscle layer of the uterus starts to contract a little bit. And that can cause those sort of period cramps that are associated with with periods, and of course that is never really seen as a positive thing to be experiencing crampy pains, although some people do get a sense of release at the time of their period and feel that resetting of their whole system. So again, varies from person to person, but in general, that would be the kind of changes that people report and notice throughout their cycle.
Yeah, in the focus groups that I did, so we did a series of, as you know, 15-year-old girls in schools, and then we did 18 to 25, 26 to 40, and then the perimenopause group. And most of the women and the girls said that it was the week before their period that was basically the worst week of their menstrual cycle, and that as you said, the relief when they had their period. So I thought they were going to say that when they had their period it was a nightmare and they couldn't do things, etc., but it wasn't. It was that week before, as you said. So tell us more about premenstrual tension or premenstrual syndrome. You know, why, and as you said, that everyone's different and has a different response. So can it really be a problem for some people? What can they do to help them get through it?
Mm. I think it is a real phenomenon, and it's really troublesome for the women who experience it. If they've got a real awareness of those hormonal changes, it can have a real significant impact. Um, it is really difficult to unpick what the cause of that is. I mean, it's definitely associated with that higher level of progesterone. Um, it is really striking in clinical trials that we usually give a treatment and then give what we call a placebo, which is something similar without the active ingredient. And quite often that placebo effect can be quite strong. So we notice improvements even in those treatments that don't have an active ingredient. And that points to the fact that this isn't just a hormonal thing, but there's also a lot going on with those interactions between the hormonal system in the body and the impact on the brain and the impact on interactions with other endocrine factors. I think it's really complex to unpick what's going on. And we know that if we do a clinical trial and people are listening and taking care, then that can have a real effect in itself, never mind a medication sort of having or working wonders in isolation. So I think premenstrual syndrome is incredibly difficult to treat because of its complexity. And it's certainly not. But what I'm not saying is it is in anyone's head. What I'm saying is it's really difficult for us as medics to find the right treatment for people because it's so multifactorial. Quite often people have a lot going on in their lives and things will bounce off each other. Nobody is their hormones in isolation. So it can be very, very difficult to find a good resolution for some of these symptoms. Things that we advise are to take regular exercise and make sure that you're staying fit and well, have a good balanced diet. Some treatments that even out those hormone swings can be really helpful for some people and not so helpful for others. And I think that's what makes it difficult as well. There may be different root underlying causes in different people. But also things like some of the antidepressant medications that are used can be used in that cyclical ways. Just using it for part of your menstrual cycle can be quite helpful. And things like cognitive behavioral therapies can be effective for some people. Herbal supplements can be effective for others. But unfortunately, I think we're in a position with PMS and PMDD that it is a little bit trial and error because the understanding of what the actual root underlying cause is not quite clear and may actually vary from person to person.
Yeah, the most common words that the women said to me were that during their PMS, they felt angry. Even it was really upsetting to hear the schoolgirls say that many of them said they wouldn't go out if it was a few days before their period was due because they didn't want to be angry with their friends, and so they'd rather stay in and isolate themselves. So
Yeah.
it is a difficult one. Can you tell us what is PMDD and how common is it, and what's exactly going on there?
Well, PMDD and PMS are probably one and the same. It's probably a bit of a spectrum. So it's the impact that it's having on someone's life. So if it's having a significant impact and really stopping people functioning, then we would say it was the more severe end of premenstrual syndrome, and that's often called PMDD. These definitions are really difficult, and they've been changed and redefined over the years, and I'm not sure we've quite standardized them. I'm never quite sure if it's helpful to label it as one or the other. I think it's more helpful to look at the impact it's having on someone's life and try and find coping strategies and treatments that will help them function better. The actual cutoff between the two is a bit vague, and I'm not sure it's 100% helpful for people.
That's really useful, because I see this thing that 5% of women have PMDD, and I agree. It's so woolly to describe that, because it's so individual about how a woman feels, and it's one thing in the school education that worries me, because the people we've interviewed have told us that at the most they've had 2 lessons, one at primary school and one when they were about 11 or 12, where they haven't had time to explore these. So I just feel that because they're not told what you've said about if it's affecting your day-to-day life, that I think I worry that there are too many young girls who are putting up with a lot of pain, and possibly endometriosis, which we'll be talking about in the next podcast, because they think, oh, well, everyone else seems okay, so I just need to get on with it. It's just a woman's thing. This is what it's like. So that really worries me about women and young girls putting up with too much. What do you think?
I think the mood disorders are under researched. It isn't my area of expertise. I don't do research into that particular aspect. I focus more on the bleeding, but I think there's a real need for more people to do more research into those mood disorders, because they do have such a big impact on people's lives.
Yeah. So let's dive into then what specific changes or symptoms people should pay attention to if they are having issues. So what sort of things should raise alarm bells? We talked about short and long cycles, but are there anything else around periods or the menstrual cycle that maybe need medical attention?
Yeah, I think there's a significant proportion of reproductive aged females who are iron deficient, and that's highly likely to be due to their menstrual bleeding. And I think that's massively underdiagnosed globally, including in societies where you would think these things should be picked up and treated better. We know that about a third of women are entering pregnancy iron deficient, and that has a knock-on impact on reproductive outcomes, neonatal outcomes, the health of the whole nation. So I think if we get periods right for women, we get things right for the whole of society. But I think the sort of red flags that people need to look out for are if their bleeding is unmanageable. Particularly, I think a factor that really correlates with heavy menstrual bleeding is flooding through clothes during the day, or passing very large clots. And if that's happening, it's not normal. It probably is an indication that your periods are heavy and that you're at risk of anemia. Unfortunately, it's not uncommon for me to see people present at the stage of needing a blood transfusion.
Wow.
I think there's about 700 women a year in Scotland. About 170 women a year in Scotland who have needed a blood transfusion, and that's from quite a small population. So if people are getting to the stage where they're coming in with an iron level and hemoglobin in their boots, from heavy periods, I think there's a sort of real issue in society for picking up and probably normalising that heavy menstrual bleeding. I think it's probably to do with the taboos surrounding menstruation, and it's probably to do with normalisation of heavy periods within families if we're not speaking more broadly about it. And quite often, if your mum's heavy, you're heavy, your sister's heavy, it can sometimes lead to normalisation of those symptoms. I think heavy bleeding is massively under-recognised. The impact is massively underappreciated. And I think in this day and age, we shouldn't be getting to a stage where you require a blood transfusion for heavy periods. So I think there's lots we can do to raise awareness of that, and hopefully people can recognise that their periods are heavy and get some of the relatively good treatments that are already available to help them manage that and make sure they don't become significantly anemic.
Yeah, so heavy menstrual bleeding is definitely a problem that perimenopausal women experience. Well, I can remember
Mm.
my last few periods were just horrendous. It's like sort of some final sort of, I don't know, thumbs down to say, right, you're going to have some terrible periods at the end of this journey. So if a woman's getting, if it's changing, so she's getting longer periods, longer than 8 days, and as you say, flooding and not being able to keep up in a day with changing her period products to cope with the period, what should she do? Should she go and see her doctor?
I think so. I think if it's unmanageable and impacting on your life, then yes. Um, what you have to remember is that heavy menstrual bleeding is something that people experience, but there are many different underlying causes for that heavy menstrual bleeding. Um, I think what we have done previously is treat the symptom of heavy bleeding and not look for the underlying cause. And I think when you do that, it's a bit like pulling up a weed without getting the roots, and it's likely to come back, even if it's treated for a little bit. So I think it's worth speaking to your doctor. It's worth taking a note of how long your bleeding is for, how often you're changing pads or tampons or menstrual cups, the episodes of flooding, the clots that you're experiencing, and taking a note of your last smear test and how regular your cycle is. These parameters can all be really useful for your doctor to kind of work out what the potential underlying cause might be. You may or may not be offered an ultrasound scan depending on the initial screen. But I think if your periods are very heavy, there are some medications that you can take just at the time of bleeding to take some of the bleeding away and help make it more manageable. And at a minimum, if your bleeding is very heavy and you're feeling very tired, you should be getting your hemoglobin checked and your iron levels checked. And potentially, you may need some iron supplements to top things up. The bleeding you described towards the end of your reproductive life is often due to the ovaries running out of eggs and the hormones changing a little bit. It can be a temporary thing, but it can also cause quite significant bleeding. And even if it's less frequent, if it's really heavy, it can cause real problems. So there are simple things that can be done. There's simple things to rule out any serious underlying causes. So I think having a conversation with your GP or your doctor is a good idea in those scenarios where it's getting a bit unmanageable. Sometimes a one-off isn't so difficult to manage, but if it's happening on a recurrent basis and really impacting on your life, I think you really should be seeking some treatment for that.
And my GP friends might not like this, but I say to my friends, really lay this on when you go to see them. Make it. I've heard many of them sort of say, "Oh, well, it's just a heavy period. Go away and just cope with it." But as you said, the things that you can check,
Mm,
and really tell your GP that it's really
yeah.
affecting your life. And I tell people, go back again and again and say you can't
Mm,
cope,
yeah.
and until they've really, that, as you said, there are things that we could do to help them. And your research is framed around the development of preventative and therapeutic strategies, which I think preventative is the key word there. What sort of things have you been looking at?
So I think what we have focused on in the lab is trying to work out those underpinning mechanisms that might cause heavy menstrual bleeding. Um, that sort of phenomenon of the build-up and breakdown and repair of the lining of the womb has been really under-researched. Many people have done terrific work in the past, but I think we really need to push forward with that and really understand those local things that occur that cause um, the sort of efficient repair of the lining of the uterus. We have shown that people with heavy bleeding bleed for longer, so the repair process after the shedding seems to be defective. And we think that's linked to the blood vessels and their constriction. We think that narrowing of the blood vessels as the tissue sheds causes a sort of really low oxygen level within the lining of the womb. And although low oxygen levels are often thought of as a bad thing, I think in this scenario, we need that short, sharp shock of hypoxia or really low oxygen levels to instigate that repair process, because this is all quite tightly regulated. And if that doesn't occur, it seems that that repair process doesn't get triggered. So people with heavy periods had that. It didn't get that low oxygen level and had delayed repair of the lining of the uterus. And that in combination with perhaps the blood vessels being a wee bit wider means that they're losing more bloods and over a longer period of time. So I guess the whole premise of our research is to work out that exact cause, because it might be different in different women. And if we can say, if, for example, one woman, you've got too much inflammation and that's causing your heavy bleeding, therefore you need anti-inflammatory medications. And in another woman, you're not quite getting the hypoxic response that's needed, therefore we need to treat you with factors that will help you get that hypoxic response. And I think in that way, instead of overriding their whole reproductive system, which is what we tend to do at the minute with our hormonal treatments, I think we can get smarter about how we treat these women, look for the exact defect that they've got, treat that, and get an effective treatment that doesn't have so many side effects. So that's the kind of work that we're trying to do in the lab, to sort of unpick those mechanisms to try and, I suppose, get smarter about how we treat heavy or problematic periods.
And you mentioned diet and exercise. So to try and prevent some of these issues, is our lifestyle, if we're looking after our stress and our diet and our exercise and our sleep, can that help?
Yeah, I think there is some quite good evidence for a healthy lifestyle having a healthy impact on your reproductive hormones and whole reproductive system. We know that regular exercise helps the ovaries function better and release an egg every month if someone's not using contraception. And, regardless of weight, if you're regularly exercising, that ovarian function is improved. And of course, if the ovaries work better, then the knock-on impact is the endometrium has got a better regulation system and is likely to function better as well. So I think regular exercise is a really important factor in general health, but also in menstrual health. We did some studies looking at weight and BMI, which is, you could argue, not the best marker, but it's what we had available, and showed that, with increasing BMI, menstrual health wasn't quite as good. And then because there's lots of factors that affect women and not just their weight, we used a mice model, and when we increased the weight of the mice, we saw that they delayed that repair process within the lining of the uterus, which kind of indicated to us that weight does have an impact on the function of the lining of the uterus, even independently of the ovaries. So I think for many reasons, a healthy diet and regular exercise is a good way forward. And trying to maintain your weight in a healthy range is good for a number of different things. It's not easy to achieve, but I think the advice is that you stay as healthy as possible, and that's going to have a positive impact.
I couldn't agree more. And in my career, I see people when they're trying to get pregnant and they haven't been maintaining a healthy lifestyle, or they reach perimenopause. And I was on a panel with Dame Professor Leslie Regan recently, and she said we really need to educate women from a young age more about their menstrual health and about their lifestyle. And I just think it's such an important message. We're bombarded in today's society with such an unhealthy lifestyle, and women exercise less than men, and it's so hard to maintain a healthy diet when you're bombarded with all of this sugar and highly processed foods. So, as you say, it needs to start early. I think really get people aware that it's a no-brainer. And then when you get to my age, you're worried about diabetes and heart disease and everything else, and all this really important. It's so important, and so it's great to hear consistent message from everyone that we need to get these things under control.
Yeah, And I think that's true. It's not just like these problems are just in the remit of the gynecologist. I think as a society as a whole, we need to um, make sure that we're making it as easy as possible for people to stay healthy. And it's everyone's responsibility, and that's only going to have a positive impact for the whole of society, right?
Yeah, absolutely. Now let's look at COVID. So during COVID, I heard a few people say that their periods went weird when they had the vaccine, and some postmenopausal women said they got a period. So what did you find about COVID and menstrual disturbance?
Yeah, so I guess the first thing to say is that what we found was that women's health and menstrual data was not really taken into account in the way it probably should have been during the pandemic. And I think we've learnt a lot of lessons from that. And I hope moving forward that will be very different. Um, but I think it was really difficult to address people's very real concerns about the vaccination and the impact on menstruation. Um, there was lots of reports with the yellow card system and in many other ways, and in the media about people reporting different changes. So we set up a survey at the time of COVID with colleagues who really drove the process in Oxford and Montpellier. And we looked at people who'd been vaccinated, people who hadn't been vaccinated, and we were really fortunate that we had that window in time where we had a group of people that had never had COVID, a group of people who had COVID and recovered, and then a group of people who had long-term symptoms of COVID. So with that really rich data set, we looked at vaccination in response to what we were hearing in the media. And we saw that about 20%, almost 20% of people experienced or reported menstrual disturbance after they had the vaccine. But when we looked at people who hadn't been vaccinated, there was no significant difference in the amount of people reporting changes. So menstrual changes are really common, is the sort of take-home message from that, and weren't more common in those who'd been vaccinated. So it goes back to that sort of natural variation that takes place, and goes back to that none of these events occur in isolation, and the stress of the pandemic, um, sort of multiple factors and life stresses that were going on at that time probably had an impact on menstrual parameters. That's not to say that people didn't experience changes when they had their vaccination, but what we see is that anybody who reported changes, it was very transient. It didn't seem to be long term, and was more likely to be due to the sort of appropriate immune response that you make to vaccination rather than anything specific in the vaccination itself, because we saw it across multiple different vaccinations for multiple different conditions as well when we went back and looked in the literature. So I took away from that, and looking at the data, there were more changes if people had COVID and more changes if they had long COVID. So I took away from that the fact that it's actually a really good idea to get vaccinated, because you're less likely to get menstrual disturbance with the vaccination than any of the sort of acute or long COVID infections that might ensue. And any changes that we did see are likely to be quite transient. So I find it quite reassuring, the data that we looked at, and felt it was a really important study to do, to try and hopefully reassure people that any changes weren't worrying,
Yeah,
although they might be hard to handle at the time.
yeah, for sure. I think with easy ways of communicating, social media, once a story gets out, then it really does explode, and it really opens the doors to myths and misunderstandings around these things. Are there any other common myths or misunderstandings that you've seen around periods?
Um, I think there's many. I think the most worrying one is just the normalization of really heavy or troublesome periods. I think it just goes back to that needing a blood transfusion is really quite a significant thing to go through for something that should be physiological and easy to manage once a month. Um, and that myth that we just have to put up with it, I think, is the one that's most worrying.
Yeah, I agree. Do you think it's helpful if women use a period tracker app to monitor and keep an eye on things?
Yeah. Um, Different people find them helpful for different reasons. What I'd say again is probably what's more important is the impact it's having on your life. And I'm not 100% sure that a period tracker um, will provide more information about that. Some people love figures and data and like to track things and do things, and that's not harmful in any way. I don't think it's 100% necessary to do it. I think if you're able to say, I'm managing okay, it's not impacting on my life, great. This is becoming really troublesome, then I need to do something about it. It can sometimes be helpful to have the summary data for your doctor about how long your cycle is, how long you bleed for, how heavy it might be, or how regular or irregular it might be. So having those high level statistics can be quite helpful. The anxieties I have about it are not so much in the actual tracking of the data, but the apps themselves and what people may do with that data. The anxieties in the States about abortion laws and what might happen if people are having regular periods and suddenly stop are slightly worrying to me. And probably more common is that targeted advertising at different stages of your cycle. And companies have to make a profit, and quite often it's via advertising. And I worry about those off-target effects of some of the apps. So I think if you're going into using them with your eyes open and you're cognizant of the negative effects and can limit those, then I don't see any harm in using them. I don't think they're essential. I think they're a brilliant source of data for research.
Yeah.
So if the data is all there, it can be really helpful for researchers. But they're a bit of a double-edged sword, and I don't think they're absolutely critical. And a bit of a personal preference about whether you want to use one or not. Many people do.
Yeah, you're right. I've worked with a few of the apps, and the data is amazing. We've published some really interesting studies with
Yeah.
huge, big data, hundreds
Mhm.
of thousands of women. It's amazing. So I wanted to look at stigma around menstruation. So it's that, as I said, that at schools it seems that women are lucky if they get 2 lessons at schools, and this has been with women in different countries as well. And we also have this issue that even right now in some UK schools, I've been told this a few weeks ago, that girls and boys they're still being separated. So the boys are either having a separate lesson about the girls having a period, or then not having anything about the girl having a period, which has a knock-on effect that the older women in the focus groups I work with said, well, my husband or my boyfriend doesn't understand my period. And I say to them, they're not going to understand because no one ever taught them. So we've got to be patient with them. So I and the schoolgirls, the word they said was stigma. They felt it stigmatizing if they had to go to a different room. And I appreciate that we want to give girls support and be able to let them ask questions. But I feel very strongly that at least the first lesson should be with the boys present. So how do you feel about this whole stigma of menstruation and what we can do about that?
Yeah, I mean, I think it's really difficult to accommodate menstruation in society and keep everyone healthy if you don't have knowledge of the underlying factors. And let's face it, many of our doctors, sports coaches, teachers are male, and if they have never been taught about it, then how can we possibly expect them to help or address it? Um, I think it's really difficult for teachers to cover everything in the curriculum, and it must be very difficult for them to keep their knowledge up to date to be able to teach on 1,000 different subjects. So the work that you guys have been doing with creating resources for teachers, I think, is fantastic. And I hope that that's well taken up in classrooms. The issue of separating boys and girls is difficult, isn't it? But I think what's really clear is that we need to teach both boys and girls about menstruation. Separating for the girls to be taught about menstruation and the boys to be taught about something else is clearly not right. And whether they're separate or together, they should be spoken to and taught about menstruation. And sort of wider reproductive health that affects both men and women. Um, yeah, I wonder if with gender becoming more fluid, if it would be less likely that people get separated in the future. I don't know, but it seems a no-brainer that everybody should get taught about it. I think it being on the school curriculum would be an excellent idea, but I think the teachers need appropriate support to deliver that in a valid and good way, rather than it being taught badly, which may be worse than not being taught at all.
Yeah, so one of the things we're doing, I think by the time this podcast comes out, it should be released. We have worked for years on a teacher resource to teach reproductive health. And there
Mm.
are obviously some resources in there about the menstrual cycle and menstruation, about PMS and PMDD and endometriosis and PCOS. That they're all in there. So we're going to work with teachers now to see if they want any more information or how we can help them. So I think you and I are certainly on the page to try and make sure that
Yeah.
with what you've done as well, where they can go into more detail, is just really essential.
Yeah.
And then this goes into the workplace. So women in the workplace, in the focus groups, some felt very supported, and working at home now, if they're having a really heavy day of their period, a lot more can do work at home, so they can not worry about flooding. So I think we're not there yet, we're a long way away, but any other thoughts about the workplace, supporting women in the workplace?
Yeah, I, I think it's really important to have um, women in positions of leadership. I think that's probably what's going to change a lot of these things, because then they can advocate for issues that are really important to women. Um, there are some amazing male advocates as well. I'm not saying that it's just women alone, but it's, I think, something that needs better accommodation in society, that people need to think about um, the colour of the chairs at work, so that if someone has an episode of flooding, it's not quite as horrific. I mean, there's very simple things that can be taken into account to allow women to function more easily without the embarrassment of accidents because of problematic bleeding. So there's, having appropriate ways to manage menstruation, appropriate toilet facilities, flexible working where possible, somewhere to store a change of uniform for both menopausal women and menstruating women. All of these things are really easy to just integrate into a workplace. And often people just don't think of them. They're not trying to be difficult, but just aren't thinking about that because perhaps they haven't experienced it, whether they're male or female. So I think there's room for improvement there. There's easy things people can do, and I think resources like yours or our website where we talk about how you can adjust your workplace on our Hope website, NHS Inform and NHS websites are getting better at including these sort of menstrual issues. I think there's some really good work being done to improve the sort of awareness in the general population, and I hope that will filter through and make life easier for people who menstruate.
Yeah, it's you talked about chairs, pale uniforms or white uniforms, or lots of the schoolgirls told me they have white PE shorts. Why would you give girls white PE shorts? At
Mm.
any time, probably someone's having a period, and white uniforms for women. It's asking for a disaster. I can always remember when I used to go to watch lots of dance when I was a teenager, and I can remember always sitting there thinking, "Those ballerinas in their tutus. What if they're on their period and they leaked?" That memory came back to my mind. Yeah, it's a bit
Yeah,
of thought.
yeah. And perhaps there's an argument that we shouldn't be embarrassed about that anymore, but we're not there yet. And I think it's easy to switch a uniform to prevent embarrassment, right?
Yeah, it's not nice. I can remember leaking at school. I started my periods
Mm.
very young. I was 9, so I was at primary school, and yeah, I can remember leaking a few times,
Mm.
and it's absolutely
No.
soul destroying. So, what about the future, Jackie? Where are you? Your research. What have you got? Anything exciting that you think might change the way we understand our periods that you're working on?
Yeah, I mean, I think it's a really great time to be working in this space. I think the media attention, and there's a sort of wave of public interest that's really highlighted many of these problems, which is always a great first step, right? We're on a constant mission to try and develop better treatments and find novel treatments or treatments that could be repurposed for heavy menstrual bleeding or problematic periods. So we're doing a lot of work in that space, and we've got some nice data coming through that's probably slightly under embargo at the moment, but we hope to be publishing it shortly. But things that we're also working on are better ways to deliver treatments for heavy menstruation, to make them more convenient for women. Hopefully things that you don't need to take right the way throughout the cycle, but can just take at the time of a period, would be really nice, rather than to have to override your whole reproductive system. If there's something that you could take or deliver just at the time of a period, I think that would be a real step forward for women. That maintains your fertility, allows you to get pregnant if you want to do that. So there's an option for those people. They can either have a treatment that is contraceptive and has that side benefit, or have a treatment that allows them to get pregnant and manage their periods while they are trying for a pregnancy. So we're working on all those kind of things. We've got some exciting data on long COVID and the best ways to manage menstrual disturbance in people with long COVID. So we're hoping that we'll have some nice papers coming out in that space soon as well. So we are really positive with some really exciting data coming through in the lab. And I think that hopefully will translate into improvements in the clinic, because that's the whole point of what I do. It's not to publish a paper in a fancy journal. It's really to get treatments improved in the clinic and make life better for those people who are really suffering at the minute.
That's brilliant. And we will put the web links in the show notes to your website so people can have a look at those. I know you've got some great websites. You've just made me think then, I've remembered something. We haven't talked about those women who are neurodivergent. It did come up in our focus groups, especially for the perimenopause, women who are on the spectrum, or autistic or whatever. They like things to be very predictable. And in the perimenopause, when your periods can become unpredictable, they found that very stressful. Have you got any information about how neurodivergent women can deal with their period?
Yeah, well, we've done a bit of work at the other end of the spectrum, and people going through getting their first period, who are, have those kind of issues with sensory issues and difficulty managing change. So we've created some resources for parents about how to talk with children who are neurodivergent about the onset of their periods and how to manage that. And then I had a PhD student looking at some issues with sort of camouflaging in young girls and them trying to be normal while they're dealing with all of these issues during their periods. So we've done some work in that space. We've also tried to create many of the resources on our website with sort of easy read summaries that people who are neurodivergent prefer to have things written out rather than watch a video sometimes. So we try to be aware of delivering information in a way that's accessible to as many people as possible. But I think when it comes down to it, I see many people coming through clinic who are not neurotypical, I suppose, and they do have different requirements. To me, it's just a bit of a spectrum of what people prefer and what their personal preferences are. I don't think I necessarily think of them as a separate population. I just think it's a bit of a spectrum on how people like to manage things. And some people don't want any periods at all. Some people want periods that are regular and easy to manage. And I think that's why we need a real armory of treatment options for people so that they can choose ones that are most convenient for their lifestyle. Because let's face it, people who are experiencing these menstrual problems are usually working, they have children or looking after elderly parents. They've got many life stresses going on, and most people put themselves at the bottom of that list of things to do. And actually, I think we need to, as healthcare professionals, help them get themselves up in that priority order, and get them functioning in a way that allows them to take on all of these other challenges in their lives that they have to cope with.
I totally agree. And I know some women like having a period, but in my surveys, I asked women, did they like having a period? And I think it was over 90% said they'll be glad when they're postmenopausal. And one of the best quotes in a focus group that made us all laugh was a woman said, when my periods stop, I'm having a party. She's having a stop
Yeah.
period party. Um, Last few questions, Jackie. So I ask all my guests, the podcast is called Why Didn't Anyone Tell Me This? And are there
Mm.
questions around or comments around menopause? Sorry, not menopause, I've got menopause on the brain. Periods that women have said to you, why didn't I know this about my period? What did they ask?
Um, I think it's probably those people who come in severely anemic, and they often give themselves a bit of a hard time saying, why did I let it get to this stage? And I think the question shouldn't be, why did I let it get to this stage? I think it should be more often, why did no one tell me this?
Yeah.
So I think I don't really get asked, why did no one tell me this so much, because women do tend to blame themselves. But actually, I think it is probably something that we do need to be talking about more so that people can identify when there's a problem and get the help they need.
Fantastic. So you and I were both on a mission to make sure that everyone's educated about these things. I don't think it's rocket science. I think we just need to get these basic,
Mm.
everything we've just discussed today, get it out there to the public. So, and to brighten things up, my final questions, Jackie, what makes you happy and where's your happy place?
Oh, what makes me really happy is getting out in the Scottish mountains on a cold, bright winter day and doing some winter walking with my family. I love being outdoors. I don't think there's anything like the mountains to put things in perspective. If you're having a hard day or a difficult time, you realize that you're actually quite insignificant amongst the mountains. And just having a good walk with some good conversation with my husband and kids, yeah, that makes me happy.
Yeah, I love autumn, and the weather at the moment has been just the light and the
Hmm.
colours is absolutely spectacular. So, and my very last question, which is always a bit tricky, what advice would you give your younger self?
Oh, I think I'd probably tell my younger self to ask for help more. I think I'm not from an affluent background, and I have felt through my career that I've had to do things myself and prove my worth and my place in where I am. And actually, I was so wrong. I think that quiet assurance of the people around me fooled me into thinking that they all knew what they were doing all of the time. And actually, it's no one really knows when you're working on that edge of knowledge. And I wish I'd asked for help a bit more, because it's all about collaboration and teamwork and moving things forward. And I think if I was to go back to my 24-year-old self, just graduated from medical school, I would tell her to ask for help more and work more in a team. You don't have to do everything yourself.
Perfect. That's really sound advice. So, Jackie, thank you so much. I'm sure people are going to learn something from this, and if we educate a few women and maybe have alerts for a few women who are having issues and realizing they shouldn't be suffering in silence, that would be absolutely fantastic. So thank you so much for your brilliant work that you're doing and keep it up. I'm very excited about the things you've got coming up in the future that I can't wait to hear about. Thank you so much, Jackie.
Thank you so much for having me on. It's lovely to chat with you, Joyce.
Bye.